there's just so much.
You're listening to a Mamamia podcast.
Australian women, welcome to your full body health check. This is Well, I'm Claire Murphy and I'm joined by Dr. Mariam. Coming up today, we'll be answering all your questions about your brain, from whether an ADHD diagnosis might have saved one of you from addiction to whether you really need to be weaning yourself off of antidepressants. Our experts have got your back. But Mariam, today's special guest is none other than your very own brain. Look, I didn't know this, that we actually have a World Brain Day, which is on July 22, where we celebrate and promote brain health for all ages. It's not something we think about, it's health. Unless you have a mental health issue, you don't think about maintaining brain health. But your brain is actually made up of about 75% water, which seems wild considering how much it's in control of. Of the actual tissue, though, 60% of that is fat, which is why things like omega-3s and 6s are so very important for our brain health. It has a higher cholesterol content than any other organ in the body, and like before you all panic, it's actually good.
Yeah, good cholesterol.
Good cholesterol, and it's really key for our learning and memory. The average weight of your brain is just over 1 kilo.
Aww.
Poor little organ. And in your first year on the planet, it will triple in size, which is why some babies come out looking a little bit Conehead, my nephew, he knows. When you turn 2, it's about 80% fully grown, but it doesn't really get to its full size until you're 18 and doesn't fully mature until you're 25. Look, arguably
debatable.
Yeah, my brother still hasn't. Like, he's in his 50s. He's still going. Fun fact, us humans have the biggest brain out of all the vertebrates relative to our body size. And it is an absolute myth that we only use 10% of its capacity. That is a Hollywood thing. There's no pill like in the movies where you can take it and suddenly like click, unlock all of its potential.
Bradley Cooper.
Yum. Great movie. Not true. Inside this mostly watery big brain of ours, though, there's somewhere around 100 billion neurons, and they are all firing to get the job of driving our bodies done.
Synapsing
their little hearts out. It can't actually feel pain. The brain, it has no pain receptors in it, but all the layers around it do. So that's why, banging your head actually hurts. It gets smaller as we get older. And according to an article from the National Science Foundation from back in 2005, the average person has 12 to 60,000 thoughts a day.
Wow.
That's 12,000, not 12 individual thoughts. 12,000 to 60,000 thoughts a day. But get this, 95% of those thoughts, Mariam, are the same as we had the day before.
That's so sad.
And how's this too? Not only is 95% of those thoughts the same as the day before, around 80% of those are negative thoughts.
Oh.
Because we're mean to ourselves.
Yeah.
Our inner monologues are often really nasty to ourselves.
We are our worst enemy.
We really actually are. And look, science does prove that men's brains are actually on average slightly larger than women's, but there is zero research that makes them any smarter. They just have,
maybe just more water content.
It's definitely more water content. 2 of the most important things we can do for our brains.
Yeah.
1, exercise.
Mm-hmm.
It increases blood flow to the brain. Oxygen then increases. It helps it do something called neurogenesis, which I wasn't aware of. This is basically where you produce more neurons. Neurogenesis increases brain volume, which is thought to help you avoid things like dementia later on down the track. And we will be getting more into dementia when we talk about things like longevity. 2 is, of course, sleep.
Yeah.
And this is something that both you and I
struggle with
a bit. I mean, you've got twin toddler boys. I have a job that starts at 4 o'clock in the morning.
God help you.
It's not great. But sleep deprivation actually can kill off brain cells. That's why you've got to go to bed and let it sleep and let it reboot and do its thing. Of course, brains aren't always on our own side either, which is ridiculous if you think about it, because why?
Yeah.
Like, why is our brain sometimes working against us?
Help me.
We're in a
brain.
partnership here. Because there are many mental health disorders. They can vary greatly between one person to another. There's neurodevelopmental disorders like ADHD and autism. There's psychotic disorders like schizophrenia and bipolar, anxiety disorders, obsessive compulsive disorders, trauma, stress-related issues, sleep and eating and feeding disorders, and that's just to name a few. Mariam, do we know why some people's brains are more prone to mental health issues than others? Is it all about genetics?
So it's shaped by a complex interplay of factors that go beyond genetics. So, while having a family history will definitely increase your chance of a mental health condition, doesn't always mean that's going to happen.
Okay.
So I always say genetics might serve as your base, like the broth in a soup, but other factors like environmental factors, so trauma, stress, exposure to violence can definitely impact your mental health and can trigger those genetic predispositions. Then there's biological factors as well, so imbalances in your brain chemistry, all those hormonal fluctuations we've been speaking about previously can definitely contribute to conditions like depression and anxiety. Psychological factors like personality traits and coping mechanisms also increase vulnerability to mental health challenges. And lastly, social factors, massive impact on your mental health. Things like isolation, lack of support systems, socioeconomic struggles, they also play a crucial role. So unfortunately, we can't always blame it on the genes, although I do. But so there's that whole complex interplay of factors.
Okay, and that's why it's so vitally important that we stop doom scrolling and go and actually speak to people face to face.
Exactly.
Social contact, so important. Okay, Mariam, today we are answering a whole bunch of questions that you guys have been sending in, including what can make your ADHD symptoms worse? Is a twitching eye stress related? And is rage a symptom of burnout? That's all coming your way next.
The doctor will see you now just through here to consult room 1.
All right, so you have been sending in your questions over the past couple of weeks. We've grabbed a whole bunch of them to ask our mental health experts today. Mariam, you are going to answer some. We also have put some to our psychiatrist, Dr. Kieran Kennedy, and our clinical psychologist, Shuktika Bose and Carly Dober too. All right, so let's get underway. Mariam, how do I help if I suspect I have anxiety or depression? Do I need to see a psychiatrist or psychologist, and where do I start?
So if you think you're dealing with a mood disorder, whether that's anxiety, depression, or something else, best place to start is with your GP. Based on your conversation with the GP, they will direct you either to a psychiatrist or a psychologist, and you may be eligible for something called the mental health care plan.
Oh, this is the 10
visits? So
visits?
the 10 bulk build sessions. Some psychologists might offer a gap, so always double check with that. A good GP will prescribe some lifestyle changes and have that conversation with you. They'll do some safety netting with you, and it will definitely be more than one consult to just kind of continually check in with you. It's really important that you continue to engage with the GP even when you're seeing a psychologist. They usually do these score systems and continue to do them throughout the year to see if there's an improvement. And if the mood isn't really improving, then there's discussion whether medication may or be a right fit for you.
Yeah. Okay. Quite a few questions that were sent in were around ADHD.
Yeah.
So we decided to put them to our ADHD specialist, Dr. Kieran Kennedy. So I caught up with him the other day and asked this question to start with. Is it actually worth going through the process to get an ADHD diagnosis? What's the point if you don't want to go on medication?
Really good question. I would say it's always worthwhile exploring symptoms and our sense of self. And even if there's a sense that the diagnosis is more mild, or even if we decide we don't want to go on medication, there are some major benefits to understanding ourselves better, being able to implement lifestyle or psychology-based treatments. So I would definitely be of the affirmative there in terms of it's definitely still worthwhile.
Is it actually possible to ever stop biting/picking my fingernails? What are some strategies? I've tried fidget toys, bad tasting nail stuff, acrylics, etc. Nothing works.
Really, really tricky. And obviously this can be a big part to ADHD when it comes to restlessness and hyperactivity. So I would recommend if it's part of ADHD, that might be where treatments and discussions with your psychiatrist or your doctor might be worthwhile, because those can improve if we improve your ADHD. They might also be related to non-ADHD related inputs. And so psychology kind of input there can be really, really helpful if we've tried everything else, as it sounds like we have.
This is an interesting one. What's with the random bruising? I hear it's about not being fully aware of your surroundings because you're always in your head with ADHD. Is this true?
So, yeah, I've actually met patients who have also described commonly knocking into things, bumping into things. And, I can kind of posit a bit of a theory here that it might be around distraction and our attention to our surroundings or what we're doing at the time. And so that could definitely be a part of things if that's the case.
Someone said they've been diagnosed with ADHD as an adult. She said, her whole life I've dealt with alcoholism and an eating disorder. Could my ADHD have contributed to my addictions?
Yeah, so this is one that I think we could definitely talk for a solid hour on in and of itself. But absolutely, if impulsivity is a significant part to ADHD for people, that can obviously, for some people, predispose towards really struggling with impulsivity when it comes to addiction and substance use. And so it's not uncommon for those two things to go together. So it definitely can. And the dovetail there is that we now know that eating related impulses and urges can be really difficult for those with neurodivergence as well. So we know that there's quite a strong relationship between ADHD and things like binge eating disorder or other eating disorders as well. And so for both of those things, it can come back to impulsivity and urge control for certain people, absolutely.
The most annoying thing about my ADHD is that I recognize that something is important and I can't lose it, so I put it somewhere safe, then I forget where that safe place is. I also lose my car nearly every time I park it. What things can I do to help this?
I think the first is knowing that you're absolutely not alone. Again, that retention and memory side is a really big one for a lot of people with ADHD. And for some people, that can really come through in the physical realm. We lose our keys, we put something somewhere, then can't find it. We can't remember where the car was parked. I think the insight into it being there is an important one. And one of the big ways around that is learning to put things into specific places, or maybe just acknowledge when we park the car, for example, make an active effort to sort of consolidate, okay, where have I parked? What level am I on? We just need to be aware that this might be part of our ADHD, and we need to be a little bit more active in sort of scaffolding, where things are and where we put them.
Are people with ADHD more prone to burnout? I read someone saying that having an ADHD brain is like a sprinter trying to run a marathon, and if they don't take regular breaks after short sprints, they could burn out easier.
Yeah, I mean, we talk about something called neurodivergent or ADHD burnout. And there is a sense that with days, weeks, years, decades, we're often working really, really hard to try and kind of keep all these balls in the air and keep everything juggled, to not forget things, lose things, all of these other items. And so people describing a sense of kind of a cyclical kind of bust and boom, or a go, 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 and then a burnout type period, that's really common. So absolutely, that can be part of ADHD. And it's usually a sign that we're really working very hard in the background of our brain a lot of the time to try and keep all these plates spinning and everything up in the air.
What could make symptoms of ADHD worse?
Oh, that is a really, really good one. A lot of things, not to overwhelm you there. But I think, I love this question actually, because I think it points to the things within our daily lives that can really impact ADHD in a number of ways, for good or bad. Sleep, levels of physical activity and exercise, having regular meals and a balanced diet, even things like time for meditation or mindfulness or doing something creative that we enjoy. We know that these things can go a long way towards improving ADHD, but also if they're not on the so regular or good side, they can actually detract and negatively impact ADHD. I think another important one is alcohol and drugs. I think with ADHD, especially the more hyperactive type, there can be a sense of alcohol or other things helping calm our mind and body. But we know, especially with ADHD, like other conditions for mental health, if alcohol and drugs are there regularly, it can really go a long way to not helping those things in the long run.
Emotional dysregulation. How do I navigate this in my workplace without needing to be apologetic all the time?
Yeah, really, really tough. I think the first thing that comes to mind here is also letting yourself off the hook a wee bit and learning to be gentler to ourselves. Part of the diagnosis that I see that's so beautiful for people can be this kinder, more open understanding of self. It's not that we can't handle work or that we're too emotional or we go off the handle. It's none of these things that we might have been told or had messaged at us. Emotional dysregulation and rejection sensitivity, as we've said, can be part of the condition for a lot of people. And so I think acknowledging that can actually, in a roundabout way, help diffuse the intensity of that element. I think it can also be around, if we're comfortable, opening up to a few of our colleagues, or maybe a safe kind of more senior colleague or boss that we have around the diagnosis as well, and that this is a part of it. And so that acknowledgement and support and understanding can go a long way as well. And I think a quick tip here as well would be, if you're starting to feel dysregulated, it's about knowing that it's okay to remove ourselves slightly in that space and time, and to just do something. It might even be focusing on the breath to just help keep our body and mind sort of a wee bit more grounded. It's okay to allow yourself to take that space to do that if you need.
Can ADHD be linked to hormonal imbalances? And how do ADHD symptoms fluctuate throughout a menstrual cycle?
So we definitely know that hormone levels and the menstrual cycle can impact ADHD symptoms. And that's something I talk to, patients about quite a lot. A lot of women, whether they have symptoms of PMDD or they notice changes in mood and anxiety with their cycle, whether they do or don't, a lot of women with ADHD notice that across their cycle each month, they can experience a slight worsening or maybe a significant worsening of things like their ability to focus, memory, procrastination, hyperactivity. And so I've seen it really quite commonly that hormone levels and the menstrual cycle can definitely impact ADHD and treatments for ADHD as well. So I think if people are noticing that's a significant factor across the month for them, really important that you talk to your GP or your psychiatrist about that. It's absolutely not all in your head. It's nothing to be ashamed of at all, because it's actually really, really common. So reaching out about that is a good way to get support.
I guess that would also go without saying that women heading into perimenopause and menopause would also see that impact ADHD symptoms.
100%, yeah.
Thank you, Dr. Kennedy. Another one for you, Mariam. 2 of my friends are taking medication for depression and anxiety. They constantly talk about weaning themselves off of it, not through their doctor's orders, but because they say it's not good to be on these types of medications for long. This person says, I feel so much better when I'm taking them, but I'm worried I shouldn't become reliant on them or stay on them.
Yeah. Look, mental health is unique to every individual. Some people may require medications for a short period of time, and some people might need them for a little bit longer, and that's okay. Reviewing and discontinuing medication when it is no longer necessary is an important part of managing a mental health condition. Antidepressant medications, as anxiety medications, they do not cause dependence, so don't worry about that.
Okay, that's good to know.
But in some individuals, if you just stop them abruptly, you can have these withdrawal symptoms, which can feel a lot like anxiety and depression. And for some people, they can be actually quite challenging symptoms.
Yeah, right.
And so I really advise, if you're considering going off medications, don't ever stop your medication abruptly. Have a conversation with your GP or psychologist. Go on a discontinuation plan. So it will be gradual dose reduction over a period of time, and then seeing how you go. I'm going to say something quite controversial.
Ooh, okie dokies. Settle in, kids.
So for mild anxiety and depression, medication is actually not recommended. We usually prescribe lifestyle changes and psychologist input, for cognitive behavioral therapy. I do find, unfortunately, in the general population, there is medication that is overprescribed without addressing those factors first. And then often those patients kind of haven't been reviewed by their doctor, and then they've been on them for a said number of years. The guidelines suggest 6 to 12 months, but as I mentioned, everyone is different. Mental health is unique to every person, but this is something we should be following up with patients. How are you feeling? How's your mood? How's everything going? Have we thought about coming off the medication? Is this something you want to trial? And for some people, they don't. They're quite happy where they're at, and that's fine. Continue the medication. But for some people, it's like, hey, I've been on this for 4 years. I'm great. I'm past all those acute stresses and I'm doing really well, but no one's had this conversation with me, so I've just continued taking this medication. So if you've been on it for a couple of years, just check in with the GP, do a mental health care plan review, have that conversation if that's something you're considering.
Don't just go, I'm great today.
Yeah.
I don't feel like taking it anymore.
Yeah, that's right. Definitely do not stop it abruptly. Have that conversation for that gradual dose reduction.
Okay. Good to know. All right. We are going to come back because we still have a whole bunch of questions to answer today. Remember, if you do want to send in questions, you can do it via email. It's well@mamamia.com.au, or you can hit up our show notes where you'll find a link to send a voice note, or you'll also find there a place to do it anonymously, which quite a few questions have done today, which I'm finding people are feeling a little bit uncomfortable talking about their mental health issues out loud, and it's totally fine. I wished it was different. I wish that we were able to have these conversations more openly and not feel any shame or stigma around it. But unfortunately, that's where we land.
Like when I talk to my mum about anxiety, she's just like, Mariam, you just need Jesus.
Well,
God bless you, Mum.
Thanks, Mum. I appreciate the feedback. All right, we've got some more of your questions coming up in a minute. We're still answering your questions right now about all things mental health, so anxiety, depression, ADHD, burnout, all the things that we've been talking about of late. This one is for you, Mariam. I have a friend who is having thoughts of self-harm. How do I help them seek help?
Yeah, this is a really challenging situation, and it's great you're seeking advice and guidance to help your friend. If someone confides in you about having thoughts of self-harm, it's really crucial to act promptly and provide support for that person. First and foremost, if they're having active thoughts of self-harm, they're at an immediate risk to themselves. So you're going to either need to take them to hospital, call an ambulance, or call those Lifeline or Beyond Blue numbers.
Which we'll, again, put in the show notes if you need to reach out to them.
Yeah, and they will give you guidance on the next steps, and just make sure that you're staying with that person until help is on the way. If they are saying they're passive thoughts, they don't have a plan, it's just something they're thinking about, it's still critical to give them that support and link them in with some mental health services. Getting them in to see their GP is a good starting point so they can have that mental health care plan and be referred to counselling or psychological services. But having that ongoing support and checking in with family and friends is really important. Like, people kind of undervalue what social support structures can do for someone's mental health. And, you know, for those that you're really worried about, just having, you know, like a tag team support, which I always have conversations about with my mental health patients, and I always encourage them to bring family and friends in. And they just, you know, Monday it might be someone, on Tuesday someone else might be checking in on them, just till they get through that acute period. And just making sure they don't have access to any means of self-harm. So especially if they're in that active phase and you're really worried about them.
And just being aware too that with mental health, often when we are at those stages where people are getting very desperate and close to the edge, you can't always see it.
Yeah,
it might not be obvious. I've known quite a few people who have lost people and it really took them by surprise. They didn't see anything was happening. And so not to feel guilty if you don't catch it, because you're not living inside someone else's head. They have to be able to share that something is going on with them, or it has to be really obvious. So it's not easy to support people who have mental health issues, but the more we talk about it, the better it's going to get, right?
And it's also important that these people seek support, because it's actually quite stressful because you're continually on edge, or you're concerned, or you have this fear of the unknown. So speaking to your GP about that, you might not have a mental health disorder, but having someone to speak to about the situation you're in is really, really important.
Yeah. So again, Mariam, we've reached out to some of our experts to answer some of these questions too. Psychologist Carly Dober was on standby to answer a few. So the first one I put to her was from someone who wrote in and said, post-diagnosis grief, how do you navigate for the life that could have been?
I think it's a really common one as well. And I guess feel your feelings, grieve, right? Because that's fine to do. And I think also understand that we can so often approach this with rose-colored glasses, and we say, well, if I didn't have this diagnosis, my life would have been perfect, when we just don't know that. We know that so many things can happen in life. So get educated from quality sources, quality health professionals. Find a community of people who might share your diagnosis or your experience, because they probably have gone through something very similar, that grief journey too, and do something with it. Write, create, paint, punch, run, get it out, because it will eventually move, but just be gentle with yourself.
So this person says that her doctor told her that her anxiety and depression is hereditary. How do I approach older family members who I suspect may also be suffering from these things?
A really tricky one, especially if we're talking about people from different generations or cultures that might be very mental health blind or resistant. But there is a genetic component to many mental health conditions. So approach them with curiosity, maybe share parts of yourself if you feel okay doing that. Keep in mind, this information they might suspect, they might know, and they might have very challenging feelings about it. So it might not be a one and done conversation. I'd maybe think about sharing, I got this diagnosis. So much of my life or my behavior now makes sense. This is what this is. Have you heard about this before? What do you think about that? And maybe kind of getting in gently to see how they go. And then if there is something that you are quite concerned about, you could share, again, I've been diagnosed with this. When I see some of your behavior or I hear some of the things you say, I wonder if that might be going on for you. I don't know, but what do you think about that? And then just see where the conversation goes.
I've got another one for you, Mariam.
Sure.
This person has written in saying, is it safe to take ashwagandha supplement for mood/anxiety as well as fluoxetine? I read that it can cause serotonin syndrome if you take both. How true is this? You are going to have to explain a lot of things because I did not understand a lot of that sentence.
Fair enough. So no, it is not safe to take the two together. So serotonin is the chemical messenger naturally found in the brain and throughout the body, and it plays a key role in regulating your mood. And it's thought that low levels of serotonin in the brain is thought somehow to contribute to mood conditions like depression.
Okay.
Many medications used to treat mental health conditions like depression and anxiety work by increasing those serotonin levels in the brain. Serotonin syndrome, it's a syndrome that occurs when you have too much serotonin, and that happens generally as a result of a medication you've been prescribed, like something called an SSRI, which is what fluoxetine is, and that's called a selective serotonin reuptake inhibitor. So it works by increasing serotonin. So when you're taking this medication and then you start another medication, whether that's something over the counter like St. John's wort or ashwagandha, they also increase serotonin levels. So all of a sudden you've got all this serotonin, and serotonin syndrome can be really, really bad and can get bad very quickly, can be life-threatening, which is why it's always important if you're on a medication for your mental health, do not take any supplements or medications without consulting with a doctor or a pharmacist prior to commencing that to make sure that doesn't happen.
Okay.
Yeah.
Okay, so I did get quite a few burnout questions, so I've put some of these to Shuktika Bose, our clinical psychologist, and we started off with a question that came in asking, is rage a symptom of burnout?
Absolutely, it is. With reducing that emotional tolerance for things, rage can 100% be a symptom of burnout.
If I think I'm suffering from burnout in my current job, is there any way of recovering without resigning if I know I can't reduce my intense workload?
Having those things in place at the end of a stressful workday can be really helpful. Having a conversation with your employer or your colleagues about how we can maybe redelegate some tasks, or how I can have that support in the middle of the day or in the little tea breaks, they're really fundamental too.
My job is really boring and I feel completely unmotivated and have no energy. Is burnout always about being too busy, or can I be burnt out from it being the opposite?
Spot on. Burnout isn't necessarily just about overworking when you're high stressed and there's too much to do. It can actually come from lack of motivation and boredom. And that's why re-engaging with things that really bring us joy, that sense of purpose in our life, is so important. And it's important to remember then that work doesn't have to be that outlet for you. If you have other outlets or can find them outside of work, hobbies, interests, socially, they can allow you to have that sense of purpose, reignite that light back into your life.
Mariam, this one is for you. I went to the optometrist. She saw that just underneath my eye was twitching. And she said that is a sign I'm under a lot of stress. Is that true?
Yes, it can be. So eye twitching can definitely be a sign of stress. It's actually pretty common when you're feeling overworked or anxious. It's like your eyes' way of saying, hey, take it easy. So it's the fancy term for it is myokymia, and it's an involuntary muscle spasm in the tiny muscles around the eye. Don't worry, it's usually harmless. Stress, lack of sleep, too much caffeine because
harmless but super annoying.
Or even dry eyes can be the culprits. Okay. But every time I think of an eye twitch, I think of Louisa from Encanto.
Oh, yeah, vaguely. It's been a while since I watched that.
With all the stress and just carrying the weight of the world.
She's the eldest
Pressure
daughter,
that'll
right?
drip, 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 but it'll never stop. You know when she does the big eye twitch before she breaks out in that song? Yeah.
She's got eldest daughter syndrome, right? She's carrying the weight of everyone's expectations.
So if you're feeling like her, just remember, take a breather, rest, cut back on the caffeine and give yourself some TLC. But, if it's persistent or bothersome or you've got other symptoms, see your friendly GP.
See your GP. Last question.
Let's do it.
Ready? So much of my social media feed is about doing cortisol diets. I have seen this in my own feed too, to reduce the stress hormone, that it'll help me sleep and help me lose weight. Are cortisol diets a real thing?
Okay. So cortisol is a hormone produced by the adrenal glands. They're these cute little glands that sit on top of the kidneys. They're so cute.
I'm not sure we refer to glands as cute, but
they are. They're super cute. And they play a critical role in maintaining things like your blood pressure, your sugar levels, and then initiating that stress response. So it's often referred to as a stress response, as it kind of prepares you for that fight or flight reaction. And it is essential for survival. We actually need cortisol. But, we know chronic stress can lead to elevated levels of cortisol. However, these levels aren't as extreme or as bad as those seen in pathological conditions like Cushing's disease. So it's not the cortisol itself that's pathological, but rather the behaviors and stresses driving the increase in those cortisol levels. Okay. And that's what we should be focusing on. So instead of obsessing over detoxing your cortisol, let's actually focus on the actual stress triggers. So there's no magical cortisol detox diet. So please.
Are you telling me TikTok is lying to me?
Please, for the love of all things holy, do not buy it. Okay? Mm-hmm. So instead, focus on a balanced diet that manages stress and indirectly your cortisol levels. So here's the game plan. You want nutrient-dense food, hydration, drink plenty of water, limit processed foods, cut back on your caffeine, prioritize sleep, exercise, mindfulness.
I'm sensing a thread through all of these mental health discussions we have had so far.
Yeah, no detox required.
Great. We love that. Thank you so much to everyone who sent through all of these incredible questions. Safe to say we have all learned a little bit more about how we work. Remember, you can send through as many as you like via our email, well@mamamia.com.au. If you do want it to be anonymous, we get it. We've got a link in our show notes that explains how to do that, as well as the link to leave a voice note if you prefer to talk it out. Thank you, Mariam. We'll be back in for another consult in a few weeks' time, so make sure you get those questions rolling in. Next week, we're going to start on some topics that I actually find really difficult to talk about because it's been a very personal experience for me and so many people I know. And we're talking about weight. We're talking about weight loss injections. We're talking about body and body longevity. That is all coming your way in the next few weeks. Don't forget to sign up to the Well newsletter too. You do not want to miss any of this very important information as it comes to you. Print it out if you wish. It's all in the show notes explaining how you can get to it. And of course, we'll be catching you soon for another edition of Well.
See you soon.
Well is produced by me, Claire Murphy, our group executive producer, Georgie Page, and senior producer, Sasha Tanek, with audio production by Scott Stronach.
Mamamia acknowledges the traditional owners of the land we have recorded this podcast on, the Gadigal people of the Eora Nation. We pay our respects to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander cultures.
Hi, I'm obstetrician Dr. Patrick Maloney.
And I'm Bridget Maloney. We're the hosts of The Kick, the pregnancy podcast that breaks down everything you need to know about making and growing a tiny human.
We cover it all with expert information and evidence-based discussion based on our experience of running a women's clinic and being parents to 4 boys.
From morning sickness to birth plans, strange cravings to baby movements, listen to The Kick wherever you get your podcasts.